My name is Dr. Lester Hartman from Westwood Mansfield Pediatrics, and today we're going to talk about bedwetting. Bedwetting is not an uncommon thing. We start to define bedwetting as enuresis at around between 4 and 5 years of age. 20% of kids at age 5 have wetting still. 10% of 7-year-olds will wet, and fewer than that will at age 8, a key time when kids want to have sleepovers, and bedwetting can inhibit them from having sleepovers or going to sleepaway camps. What are the causes of bedwetting? It's not totally clear, but we think it's a multifaceted issue. 1, some kids have small bladder capacities. 2, some kids are deep sleepers. And 3, some kids don't develop what's called antidiuretic hormone, ADH, which causes you to hold on to water in your kidneys at night in phase 4 sleep so that you don't wet. And in extremely rare cases, there's a pulling or tethering of the nerves attached to the bladder and the bowels, which will cause problems with both, sometimes daytime accidents and constipation. And in rare cases, 2 times in my 26 years, there needed to be surgery on kids to fix this. So, what are the issues around wetting? 1 is don't punish your kids. 2, sometimes kids' self-esteem are affected. For example, if a younger sibling has become toilet trained and they continue to bedwet. So these are times when there can be interventions like bell and pad or alarm systems. Those take about 3 or 4 months to work, and parents have to be very dedicated to it and be willing to get up a lot at night. The other thing is if kids want to go to sleepovers, there is a medicine called DDAVP that we will give for that night, and 80 to 90% of the time it will prevent bedwetting. Some parents just give their kids a sleeping bag and an extra pair of underwear when they go to sleepovers. DDAVP can also be used if somebody goes to camp for a month. That's not a problem and can be used every night. So this should not inhibit a child from doing exactly what they want. It's important also to remember that sometimes kids that are camels, in other words, they only urinate a few times during the day, if you try to get them to pee more frequently, encourage them to do that, it may actually help them speed up their bedwetting problem in making it go away quicker. Secondly, some kids are frequent urinators. They go all the time. Get up in the morning, that's the first thing they do, immediately hop out of bed. Versus the camel, who may wait an hour before going to the bathroom. And those frequent urinators, occasionally there is medication called ditropan that can help reduce the spasming of the bladder and reduce urinary problems at night as well. Very, very rarely do we need to send somebody to a specialist because kids do grow out of this themselves. So keep that in mind. There is light at the end of the tunnel. 75% of the time there's a family history of bedwetting, and sometimes that parent, if it's one of the parents, can share with how long they had the issue. Don't make this punitive. Figure out a system how to change sheets if you have to at night, or just continue to use pull-ups till this goes away, or to a point where it's tolerable enough that it's on occasion that you can clean up, and that's all you have to do. But remember, this is not a serious problem in kids, but we do need to check a urine specimen to make sure things are fine. It's extremely rare that we find anything unusual, and it is not generally a sign of diabetes either. This is Dr. Lester Hartman giving you a discussion about enuresis or bedwetting. Thank you very much, and have a nice day.